Hi, my name is Venkatesh Mova. I'm a physician specializing in sports medicine and regenerative medicine. So we're going to talk about regenerative techniques and new technology that's been evolving in the field of regenerative medicine, regenerative orthopedics, interventional orthopedics, we call it these days. A tremendous opportunity to avoid surgery in most of the cases. And an option which was not available several years ago was popularized by the athletes only. We used to see like athletes going overseas, Peyton Manning, Kobe Bryant, but now it's available in US, and we've been pioneering this for the last several years. And as a group, Regenexx, that's our group, we have basically performed more number of procedures in the stem cell and the regenerative field, plasma-rich platelets field, than anybody else in the world, obviously. And we have also published around 30% of the literature on interventional orthopedics and regenerative medicine. So that's what we're going to talk about. And I do practice in two locations. One is in Dallas, Grape Vine location, where we offer stem cell procedures for orthopedic problems. So we're talking about knees, shoulders, ankles, hips, lumbar spine, cervical spine, wrist, basically most of the peripheral joints in the body, as well as the spine related issues as well. Typically I know a lot of people have questions about, hey, what is this? We've been reading so much online, hear so many conflicting information, embryonic stem cells versus what are these stem cells? Typically what these cells are in USA, FDA approves us to do only orthopedic stem cells. So we're talking about your own stem cells. We take it from bone marrow, from your body part, most likely from the iliac crest area, and we process them and re-inject back into the target tissue. So if it's a knee, it's a meniscus tear, if it's a cartilage issue, that's where we target it, and we do it precisely with the help of an ultrasound guidance or an X-ray guidance. So it's always image guided exact placement of the cells. So that's legal in US, and that's allowed. So we do it within the guidelines, and that has become a mainstream these days. It wasn't there like 3-4 years ago. A lot of athletes, you see them going overseas and getting it done. So now we have brought in that thing and made it available for common public, just a weekend warrior, an old person, young athlete, you just name it, anybody from a sports injury all the way to the degenerative condition. So there is no basic age limit on who is a candidate. So that's basically what we are offering nowadays. And it's an exciting time. This is basically the future of medicine. We all believe this is like the next great invention, because it's minimally invasive and it's a procedure compared to any kind of a surgical intervention. So basically, Regenexx, Texas is what our office location. It's in Grape Vine location. What we are offering there is stem cell treatments and plasma-rich platelet treatments. So these are basically procedures where we need you to come multiple times, but there is no downtime to it other than a couple days after the procedure, and the recovery is much faster compared to any surgical procedure. So we evaluate the patient and review his MRI scans, and we'll get our own X-rays if needed, and we'll come to some kind of a treatment plan. So we will recommend who is a good candidate for these kind of procedures and who is not a good candidate. And so basing on all these factors, so we will recommend what kind of result can you expect out of this. So these will be done at the office location, and once we evaluate their clinical examination as well as medical records, then we put patients into the treatment plan, which would include for them to come back 2 to 3 times depending on the condition. And all are outpatient-based procedures. So they come in, and once the procedure is done, 15 to 20 minutes is the maximum each procedure takes, and they will walk out with the help of some bracing or possibly crutches in some scenarios. and then we follow them up on a regular basis. We also put them on a lifestyle modification, which includes their gait training, their mechanical strengthening of the body parts. So we kind of give them and follow them and work with them, not only treatment of stem cells into their body parts, but also how to modify their lifestyle and improve their functionality in return.